Hi, my name is Sreepadaarchana Munjuluri, and today I will be presenting about exploring the complex realm of cardiovascular disease. So just a little bit about me. I am a rising senior at Columbus North High School in Columbus, Indiana, and I'm interested in exploring the nexus of medicine policy and advocacy. And so far, I've been involved in research at the IU School of Medicine, and I've served some leadership roles in the HOSA Future Health Professionals organization. And I lead a local chapter of an organ donation advocacy club as well as a career initiative that I founded. And I serve as a youth ambassador in my city. And in my free time, I explore the arts through violin, dance, and spoken word poetry. So just as a quick overview, I'm going to start by defining cardiovascular disease, taking a look at some of the disparities and the different factors and risk factors. And lastly, I'll be presenting a research project that I conducted. So starting off, cardiovascular disease is a broad term for a group of disorders of the heart and blood vessels. And most of these disorders occur in conjunction with a condition called atherosclerosis, in which plaque builds up in the arteries and causes reduced vessel space, as you can see in this diagram to the right. And in more severe conditions, the plaque can rupture and cause blood clot formation. And in further severe cases, that can lead to heart attacks as well as strokes. And many of the commonly known heart diseases, such as coronary heart disease, peripheral arterial disease, all fall under the umbrella of CVD. And this is an important issue because cardiovascular diseases are the leading cause of death globally. And these statistics are staggering. Cardiovascular disease accounts for 1/3 of all global deaths. And it's disproportionate because over 75% of CVD deaths take place in low and middle income countries. A study conducted by the CDC showed racial disparities in heart disease as well. For example, non-Hispanic Black persons were more than twice as likely as non-Hispanic Asian or Pacific Islander persons to die of heart disease. And they also found statistically significant differences in simply the incidence of heart disease within racial groups as well. On a global scale, differences in the prevalence of CVD between ethnic groups has also been found. So for example, this study found that South Asians have the highest prevalence of CVD, followed by the Black demographic in close second. Combating these disparities is a very challenging issue because CVD itself is a multifactorial disease. Patients present with many risk factors. They can present with some history, and because of these various elements playing a role, there isn't a specific pathogen that we can target to help combat the issue. The most effective research that we can conduct to help combat these variances and disparities and inequities is complex research, comprehensive research that takes into account, for example, a cultural phenomenon with a biological inquiry. So let me show you an example of that with a research project that I conducted alongside my colleagues. So we looked at the capsaicin and TRPV1 channels in the cardiovascular system. And capsaicin plays an important role in many cultural cuisines because it's actually the major pungent component of hot chili peppers, which are used to cook spicy food. Capsaicin activates the TRPV1 cell channel, which is a cell channel that is endogenously expressed in both vascular smooth muscle as well as endothelial cells. So much of the literature that we analyzed showed that there are actually many beneficial roles of capsaicin. It's been proven to show vasodilatory effects, antimicrobial properties, and its anti-nociceptive properties caused it to be approved by the FDA for the management of neuropathic pain associated with post-herpetic neuralgia as well as neuralgia related to diabetic peripheral neuropathy. On top of this, specifically the vasodilatory properties are very beneficial to cardiovascular patients. However, we found that there was a growing body of evidence that actually showed vasoconstrictory effects. So ultimately, there is a balance between the vasodilatory effects, which occur via the endothelium, and the vasoconstrictory effects, which occur via the vascular smooth muscle cells that are caused by capsaicin. And this diagram below shows the difference between a normal artery and a dilated one and a constricted one. So, specifically focusing on these concerning vasoconstrictory effects, pro-inflammatory conditions such as obesity cause inflamed blood vessels, and those activate the protein kinase C, which then causes sensitization of the TRPV1 channel to capsaicin, heat, and acid action. And the issue is that inflamed vessels have dysfunctional endothelial cells. And as we looked on the previous slide, dysfunctional endothelial cells means that there is reduced or completely lost vasodilatory ability. And instead, because of capsaicin-induced constriction of the smooth muscle, the balance tips towards the vasoconstriction side. And now, in more severe cases, this vasoconstriction can cause vasospasm, arrhythmias, and even myocardial infarction or heart attacks. So in the conclusion of the review, after all the analysis, we found that people with pro-inflammatory conditions such as obesity, metabolic syndrome, and pre-existing arthrosclerosis should stay away from excessively high consumption of capsaicin-containing foods or supplements because the expected beneficial vasodilatory effects can be overridden by capsaicin's vasoconstrictory effects that can ultimately decrease blood supply to the heart. So as we looked at today, CVD is a vital global issue that needs to be addressed now. It takes a lot of work and we need all hands on deck. And there's a variety of ways that we can get involved. Conducting further comprehensive research is one way, but also playing a role in raising awareness in our respective communities can also be really beneficial. And advocating for equity in healthcare and increased government initiatives to help combat this public health crises can really help diminish this problem. Here are my references. And I'd like to thank my family for supporting me all the way, and Dr. Abukov for mentoring me through research, and thank you to anybody who contributed to this review article, and lastly to the GHLC program for giving me this amazing opportunity. Thank you to everyone who's listening, and here is some contact information if you have any questions. Thank you.